Some relief for Sydney-siders as several of the COVID rules brought in during the Avalon cluster outbreak last month are rolled back.
We know that there's no such thing as a perfect system, and the risk of an outbreak is always there.
From 12:01 a.m. on Friday, you'll be allowed to have 30 visitors inside the home, up from 5. Outdoor gatherings will increase to 50. Weddings and funerals will be capped at 300 people and will be subject to the 1 person per 4 square metre rule. There's no singing or dancing. Only 20 people in a bridal party are allowed on the dance floor. You'll no longer risk a fine if you forget your mask at shopping centres or supermarkets, but they'll remain compulsory on public transport, places of worship, hairdressers, beauticians and gaming rooms.
We strongly recommend people wear masks if they're vulnerable, if they can't guarantee social distancing. And we also in particular ask supermarkets and other places to consider what their staffing policy might be around masks.
If the current trend of cases continues, the Premier says in 2 weeks, hospitality venues will be allowed to go back to pre-Avalon settings of 1 person per 2 square metres. But
do we need to increase fines to make sure businesses are being as vigilant as ever?
Fragments of the virus have been detected in Liverpool's sewage treatment plant.
Our focus is particularly on Western Sydney and southwestern Sydney. So as a special call out to those communities, please come forward for testing.
Certainly in the last couple of weeks there has been a tendency, I think, for complacency to set in. The testing numbers have been sitting around about the 8,000 or 9,000. That is not adequate. We need to have clear information as to whether or not the virus is still circulating in our community.
The vaccine rollout begins mid-next month in New South Wales, but even if you've had the jab, you'll still need to present for testing if you have cold-like symptoms.
No matter what circumstance you're in during the pandemic, whether you've had a vaccine or not, if you have any symptoms, you need to come forward and get tested, and that will be the advice.
Kenny Heatley, Sky News.